First of all, what does home the home project stand for? The HOME. Do you even know?
So HOME stands for HOME stands for Homeless Outreach and Medical Education,
Okay.
because it's a kind of a two-pronged project. So both service to homeless individuals, but also teaching our students about caring for the underserved.
So what happens in this program then? Because I've gotten to see a little bit of it. Like we've seen the mobile. What do you call it? Like the mobile
It's a
hospital?
mobile clinic, but
Yeah.
it's like, yeah.
So what goes into the home project itself?
We basically function like a regular clinic. So we can see acute problems or chronic problems like diabetes or hypertension. We do a lot of wound care, especially, in the homeless population, they have a lot of wounds. We can even do like minor procedures, like suturing up wounds or things like that. We also have like a ultrasound, so we we can even do like kind of point of care ultrasound and labs and things like that for our patients. And we're very much woven into the curriculum for the medical school. So all 4 years of medical students participate in one way or another. And so we are one of the first year community health sites. And so first year students sort of learn the ropes of the clinic and kind of serve like the MAs at a clinic would, in taking patients, doing their vital signs and things like that. The second years serve as managers of the clinics. And then the third and fourth years, who are our clinical students, serve as the providers at the clinic. And so, oh, sorry. They
Hopefully that's not like a medical emergency call
no.
that we're keeping you from.
No, that one is not.
Okay.
But the third and fourth years are our clinical students. So they're like the main providers. And they're, of course, they're supervised by faculty physicians, both volunteers and ones that work at the medical school. But they actually see the patients. They're the main providers. What are you? We're doing a podcast.
John, quit ruining the show, man.
It's like listening to it so loud. But yeah, so the all of the third years rotate through the clinics during their family medicine rotation, and then in the fourth year they can come through as an elective, and it's an underserved care elective.
And do they see patients all strictly through the mobile clinic, or are there other locations that they service the community, the homeless community?
So for home project, it's usually out of the clinic, out of the RV, or the mobile clinic. We do have one site where we actually have an actual clinic, and that's in our Chinatown site. It's called the Joint Outreach Center, and it was opened by the police department,
Oh,
and
wow.
it's right next to the Chinatown police station. And so it's a place where a lot of different outreach providers can go to service the homeless, and we can use the facilities for free. So it's really nice. It's a nice program. And right now we're there once a week, but we'll be expanding to twice a week probably soon.
How does having the home project and the clinic serving the homeless population, I know how it helps the homeless population directly, but how does it also help or affect the community at large by having the ability to service the homeless specifically in your clinic?
There's the community health centers that are, meant to kind of help more underserved populations. But even with the community health centers, there's still not enough care that goes out to people who are uninsured, or maybe can't just navigate the regular healthcare system. And a lot of our homeless population falls into that kind of gap group, whether it's they can't get transportation to see the doctor, or they just don't understand how it works, and or they've had really bad experiences and they've been treated badly
Yeah.
by different providers, and so they don't feel comfortable going to clinics. And so I think by us going out to the sites they're at, and providing care that they might not be getting otherwise. One of the biggest ways I think it helps the community at large is it decreases the burden on like emergency services
Mm,
and the emergency rooms. And because a lot of times if they'll just let their problems go until it gets really bad, and then they end up calling the ambulance or going into the ER. Now the ER still sees a huge amount of homeless individuals, but I think we do see decreases in the amount of EMS use when we have our clinics. And so I think that's a big help to the community. And I think just in general, trying to, I don't think our services necessarily is solving homelessness itself,
hmm.
but it certainly does help people to get connected to services that might help them to then get out of homelessness. And so because health is such a big factor, I think
Yeah.
people don't realize like how many it's a very common occurrence when we're talking to our patients that we find out it was because of some type of health problem that they either lost their job or they couldn't pay the bills. And so that's what ended up pushing them into homelessness. And so getting
Mm.
people healthy again is really I think a big part about getting them back into kind of mainstream society.
And since this pandemic has started and the effects of COVID 19, I think a lot of people in the public have been wondering out loud and in discussions like how it's affecting the homeless population, because it seems like not only were they already dealing with some difficulties before the pandemic, but now there's even more stress on resources, but also there's a lot of people who are losing jobs and having health issues, and you got to assume that that's also going to add to the homeless population. And what have you seen as far as how COVID-19 has affected the homeless population in the communities?
One of the biggest things is a significant decrease in the amount of resources and outreach that's available for the homeless. Some of it is the organizations are scared, right, to
Yeah.
kind of go out and do outreach at this time. A lot of churches that usually provide meals and other types of outreach services, they're not even meeting, right? They've
Mm-hmm.
closed, so they're not providing services. And so it's even harder now for them to get those services. And I think also because people that used to not need services, there's so many more people, like you said,
Yeah.
that need food and need help and who are unemployed now, that the amount of kind of resources that are out there is getting thinned because it's going to people that used to not need those services. And even though like there's a lot of these food drops and food distribution things, which I think is amazing and really great for the community, but our homeless patients, like, they don't have cars, right? So it's
Mm.
not like they're gonna go and wait in line for this food that's being distributed, so they're not
Right.
getting those kinds of services. um, the other thing is that I think there's a lot of fear about homeless individuals right now, which is really unfounded because there's like on Oahu, there has been 0 cases of COVID in the homeless. I mean, not one single person who's homeless has tested positive. And I think people just assume like because they're homeless, like they're more likely to have it, which there's no scientific basis for that.
Right.
And like nobody wants to go by them anyway, so they're actually sort of protected
That's
because
true.
yeah, like people naturally socially distance themselves from homeless individuals. And yes, they amongst each other, they might live close together, but if nobody ever gives it to one of them, then they're not going to spread it. And even the one that was on Maui, so there's only been one homeless individual in the state who's been positive, and that was on Maui, and that was a visitor. So, or
Oh.
like not a visitor, but like, yeah, somebody that came from the mainland. And so,
Mm-hmm.
there's, I think people just have this, unfounded fear of working with the homeless right now, which really they're probably safer than the general public. So
Yeah, I mean, that was something that I was going to ask you because that's something that we haven't really heard much about in the news. And I was very curious to hear just what the statistics were and even if they are in a better or worse situation to, you know, for their health and safety and such. But that makes a lot of sense, what you said.
it is true that if they get it, they'll probably suffer worse consequences because they're already kind of at this baseline immunosuppressed state, because
Mm.
they're malnourished, and just the kind of the constant stress of being outdoors. There, so if they did catch it, they probably would be more susceptible to a lot of the complications of COVID. So we're
Mm-hmm.
really hoping that they don't get it.
How has COVID-19 affected Home Project and what you are able to do? And I know you have a couple things that you guys are doing specifically that I wanted you to share about as well. But how has this pandemic affected the Home Project?
Early on, it really did affect us quite a bit. Number one, because we're affiliated with the medical school and we're basically run by medical students, right?
Mm-hmm.
And when this all started, our medical students got pulled out of all clinical experiences. So
Oh,
nationwide,
wow.
the recommendation from the AAMC, that's the the body that runs medical schools, basically, their recommendation was to pull all students out of clinical settings. And in our like our hospitals and clinics here, they didn't want the students anyway because number one, I think they were just trying to figure out like what they were going to do, right?
Mm,
And
yeah.
they didn't have enough PPE, the like the masks and the face shields and things like that, so they didn't want to waste it on the students. so
I'm sure
so
that's
they were
not
like, you
the
stay home.
verbiage they wanted to use, but I get what you're saying.
Yeah. So, I mean, it was really stressful. And even though actually Home Project did have enough PPE, they weren't allowed to come to clinic. So it was really hard, and it was really funny. I mean, we're like doctors and we can see patients on our own, but it was really funny. The first clinic we had, and it was just all doctors. It was like 3 doctors. And everybody was like, how are you supposed to do this? And like the med students always check in the patient. And like,
Wow.
how does this work? How does this thermometer work?
Yeah, because for
So
them
it
it's
was kind
been
of funny.
years since they had to do those things, right? Like
Yeah.
decades. And it's probably the technology has changed since the time they were using it, right?
Yeah. So yeah, in the beginning we were seeing patients just on our own. And so I feel really fortunate. We've had a really nice group of volunteer physicians that have really stepped up and were willing to come out even without students, and they've been kind of keeping our clinics going. And
Oh
then the
wow.
other thing that happened though was that for a lot of our sites, we had to shut them down because several of our sites are located at churches, and
Oh
some of our sites that are located at the shelters, they really wanted to limit the amount of people that were coming in and out.
wow.
Um, so actually, the 3 clinics that we're having every week now are all brand new clinics.
Oh no way.
So and then one of our other clinics, the Chinatown Clinic that I was talking to you about, it's really small, and so we didn't feel like it was a safe environment to have
Oh
because there would be so much crowding in the
Yeah.
clinic. So until we can work something out with that one, we probably won't go back to there and until like maybe things start settling down a little bit more. But then so we were for 1 week we were like, well, maybe we're only going to do, we were still going out to our Waimanalo clinic because that's an outside clinic, and we were still going to go to our Haleiwa clinic once a month, but those were both just once a month clinics. And then the post site opened up at Keehi Lagoon. So for those people that don't know what post is, it was started by HPD, and it's actually a joint program with the city and the state. And they basically set up tents for homeless individuals, and it's like fenced off. And there's 4 different sites at Keehi Lagoon, and it's a place where homeless individuals can go and voluntarily quarantine themselves for 14 days. And it's to sort of prove to people that they don't have the virus. And
Mm-hmm.
so if they're trying to get into, because the shelters aren't going to take anybody
Oh
new
yeah.
in, and programs like rehab and stuff like that also are very wary about taking in new people. So
Whew.
and of course landlords and things like that. So
Right, right.
um, this is a way for them to kind of prove that they don't have the virus, and it's easier to get them into services. And then so it's called a red zone, and then there's also a blue zone. So if they graduate from the red zone, they can go to the blue zone, which has a little more freedom. They still are supposed to kind of not leave the area though, but then there are more services that are willing to come and help them at that time because they know that they've gone through the 14-day quarantine.
Mm-hmm.
So and then they can hopefully help them to get into more permanent housing. And so this post site has been great. You know, we try to recruit also patients that we find that might be willing to go to this site, and you know, they provided kind of basic things like they made showers for them, and there's bathroom facilities. They each get a tent and like a sleeping bag and things like that. But you know, like they're only given like 2 MREs a day,
Oh
which
wow, that's it.
is
Wow.
yeah.
Because those are not even that hardy in
Yeah, no.
themselves, right?
Yeah. So
Wow.
so we're going to the post site twice a week, and that's also why we started our new breakfast program, and actually more recently our lunch and dinner program when we go there, because they only get those 2 MREs a day. So when we're
Mm-hmm.
at clinic, we try to provide a meal for them as well,
Oh
and not
wow.
just the patients that come to our clinic, but just for everybody at the site.
Yeah.
um, yeah, just so that, you know, they feel a little bit better. And they were like, so last Saturday was our first breakfast, and we gave them breakfast bentos with Portuguese sausage, eggs, and rice, and they were so excited.
I
It
would be
was
too. That
great.
sounds good.
Yeah, it was really good. And you know, just to see their faces, and they were like so thankful, you know, just to have a meal like that. So um I was that was my first like Facebook fundraiser.
Mm-hmm.
That somebody like just recommended, like, oh, you should just put it on Facebook and I'm sure people will donate. I'm like, well, okay, I'll just try. And I was like, wow, it really works.
Yeah. We were watching it almost like a live ticker as the donations kept exceeding the ask, and then the ask would grow
Yeah.
and it just keep growing, and we're like, man, this is gonna hit numbers that you probably weren't even expecting.
Yeah, yeah. So that's why initially we were only going to do breakfast on Saturdays, but now we have enough that we can also provide meals on Tuesday when we go, because we go there on Tuesday and Saturday. So
Oh,
we're
great.
going to do lunch or dinner on Tuesday and then breakfast on Saturday.
Yeah, I don't care where you are in life, or what age you are. If you're offered Portuguese sausage, eggs, and rice, that'll make your whole day. You know, that's like the spirit food of the gods.
Yes.
Based on just the Facebook campaign, how many meals were you able to provide for the camp?
We made 75 bentos this past Saturday. There's around there, it fluctuates. It goes between like 60 to 75 people. And we probably will be able to feed them throughout until September on Tuesdays and Saturdays.
Wow, that's
Yeah.
amazing.
Yeah.
Oh,
So
that's
it's
so
really
great.
great. It's really great.
So,
Yeah.
are there other areas? I mean, are you still trying to raise funds for this program, or are there other areas that you could use help in during this time, and or other ways that people can help you guys out?
Yeah, I mean, we're still accepting donations for the food program, even for just our general clinics, because this is the COVID situation has definitely affected our fundraising as well. So we were gonna have a spring like Easter brunch fundraiser that we
Mm-hmm.
had to cancel, and we're also going to have to cancel our fall
Oh
like
man.
our that was our main fundraiser that we have kind of that you've helped us out many times with, and so we're a little worried, like what we're going
Yeah.
to be doing, because that's we don't get funding from the government or the state, so we really do rely on kind of just grassroots fundraising, and so we're a little concerned. And now also it's hard for us to ask people to that's what another reason I was just so blown away by the generosity of everyone, because I think a lot of people are having a hard time, and so it really warmed my heart when I saw like comments like spent part of my stimulus check on donating for the homeless, and I was like, that's amazing, and but it's hard to ask people for money right now because we
Yeah.
know that everybody's having a hard time, so
But at the same time, there are people that want to help, but they just don't know where they can help. So
that's true.
I think this is great in that there's definitely going to be people that want to help, the causes that you guys have and help with the population that you're affecting. And so just to know that you're out there and that the needs
Mm.
that you have, I think it'll be good. And just to get an idea, I know the funding and donations that you get to support the program go to fill tons of different areas, but what are some of the key things that the money allows the program to do that maybe can help people realize, like, oh, this is what my money would go to?
We provide free medications for individuals that are uninsured. So if they have insurance, we can get their medications through that. But a lot of our patients don't have insurance, so
Mm-hmm.
we provide medications for them. Um, Vaccinations are really expensive, and
Mm.
so that's where we spend a big part of our money. And if the COVID vaccine ever gets produced, certainly we will want to be able to provide that for our patients as well. Just general medical supplies, just like wound care supplies and, simple medical equipment, that breaks down or things like that. We are constantly needing like gloves, and especially now we need more protective equipment. So like
Right.
buying masks and face shields and gowns and things like that. So sanitizer.
Yeah.
um, yeah, so general medical supplies. And then also, one of the areas that we do spend a lot of money on is if somebody is uninsured and we can't get them like emergency quest or something like that, we also help to pay for their specialty visits. Like if they need to see a specialist, we try as much as possible, and we have great specialists that donate their time as well to us. But like if they need a special procedure or something, so like we paid for somebody's surgery to get a cancer removed, and
Oh
those kinds
wow.
of things. So we will pay for imaging services if they need it, like if they need a CT scan or something like that. um, yeah, so just kind of general medical procedures. And then so We have one paid employee, and he only works part-time for us, but we have to keep paying him too. So, just the personnel cost as well, that contributes to our funding needs. Oh, and then our van. So
Right, right.
I feel like my RV is just taunting me.
Why?
Because there's just something always happening with it, and we fix one thing and then something else breaks, and then we have to fix something else, and so now it's in the shop, and we've been working out of our small passenger van because the starter on the RV is broken or something, and it's just one thing after
Oh my
another.
gosh.
But and those add up, those mechanic bills.
Oh yeah. I mean, I can only imagine how much it costs to repair a big RV versus like our little Honda Fit, which that's expensive just to, change the tires on that thing.
Yeah.
No, I'm glad that you're able to explain, some how the funding helps because I think a lot of people they just assume, oh yeah, I'll donate money, but they don't necessarily understand the relevance of where their money goes. And to
Hmm.
hear the things that you constantly have to buy, I think we would take it for granted. Like we just assume you go to a clinic or hospital, yeah, you guys have protective equipment and gloves and medicine, but
Hmm.
we don't think about like, well, somebody's got to pay for that, right? We just
Yeah.
think,
Yeah.
oh yeah, of course they have it. Well, all of this financial help and support is what's going to help Home Project get all these things.
Hmm.
So, what's
Hmm.
the easiest or the best way for people who would like to support and donate? How do they do that?
So if they go to our website, it's www.hawaiihomeproject.org. There's a link on that website to donate to the foundation. So we are an entity under the UH Foundation,
Hmm.
but there's a direct link to our code with UH Foundation, and that's where they can give a tax deductible donation.
I know you're super busy, so I want to let you get back to saving the world. But thank you so much for all that you do, not just for our community, but for the students too, and for the homeless population. And I just feel like what your program and your volunteers and everybody that makes up Home Project are doing is really necessary and special. So thank you for doing that. And I'm looking forward to seeing all of those meals delivered. It sounds like a lot of smiling faces are coming your way.
Yes, yes. Well, thank you for letting me share about Home Project. Yeah.
We'll see you soon, hopefully. And
Okay.
all right, have a good night. Tell John to he can go back to ruining the rest of your work now.
I will. I will.
All right,
Thanks.
thanks. Bye.
Bye.